I am joined as ever by my good friend, Dr. Richard Scott. Hello, Doctor.
Good to meet again, Andy. You're looking good, but still sounding a little bit rough.
Yeah, well, it's hay fever. It's rapeseed. Actually, I'll turn my light on as well. That's better. Less shadow behind me. Yeah, it's the rapeseed, and it's frustrating me because it is my favourite flower because it's a crop. And when you look, it's this sea of gorgeous, rich, deep yellow. And the problem with the richness and the gorgeousness is my throat doesn't like it.
Sure.
But we carry on. I don't think I've ever actually introduced you as Hello Doctor. It's always Hello Richard, but...
Although the doctoring is beginning to fade into the rearview mirror.
Because you're now retired.
This program, it keeps me sharp in the medical department, as I'm not actually practicing now, but it keeps me looking into articles and looking into subjects, and so plenty of time to learn, even if I'm not necessarily practicing.
Fantastic stuff. Now, you told me the topic before we started this one, and I thought, oh, horses. I'm going to stop there and just hand straight over to you.
Well, that's very kind. Well, I like to bring something topical, as you know, and an article came up a couple of days ago on my Premier Christian news feed, and it reminded me of a patient I'd seen many times as a GP. He came in initially, he was a young man, thin, anxious, late 20s, looking, to be honest, fairly typical for a drug addict. And we get a lot of drug addicts in Margate. And usually by the time people who in the addiction scene come to the GP, they're pretty desperate, and they're often quite honest at that point. They're going to open up about what their problems are. Not everyone, but many people did. But he was honest. And his addiction was to a substance where I knew little about, except that I used to use it when I worked in Tanzania as an anesthetic, ketamine. We used it as a short-term knockout drop for 10 minutes. You could do a short-term operation. You could keep topping it up. It was very useful. And it's still used in anesthesia today. But I wasn't so familiar with it in the addiction scene in Margate. We knew a lot about, of course, alcohol, cocaine, heroin, the usual substances, plus diazepam, stuff that we prescribe and then gets abused, opiates, which maybe people use for pain and then get addicted to. But ketamine was a new one. So my ears pricked up. What's he got to say? And he told me the one big issue with ketamine, directly due to the drug, is something which I really want to bring up today, because there may be parents for whom this will be relevant. And it's this: if you become a Ketalar or ketamine addict, you often have to pass urine every 10 minutes because ketamine shrinks your bladder massively. Now, that's, of course, not something that users get maybe offered stuff at a party know about when they start, but it soon absolutely dominates their lives, as it dominated the life of this young man who came before me. So I'd forgotten a bit about it because I've now retired for 9 months, until the article this week. And the article was entitled, "Ketamine is Ruining Young Lives, What Christian Parents Need to Know." So clearly it got my attention. And it emphasizes that ketamine is cheap, it's accessible, mildly addictive, not terrible, but it is addictive, and very damaging. And it causes not only chronic urinary incontinence, but severe bladder pain, with teenage addicts often wetting the bed. And it was saying, maybe it was based in Lancashire, this article, that it was beginning to wipe out young people in Lancashire. Didn't say what wipe out meant. Did it mean kill them or just cause them a lot of grief? Didn't say. But I thought, well, I'll look up ketamine, because this was clearly a substance that's now causing grief just beyond my own patient. And I learned that it's not a new kid on the block. It began life, interestingly, in 1962 as a potential analgesic for pain. And indeed, it was licensed for pain relief in the Vietnam War for the US. Now, Andy, you mentioned horses. You're quite right. Do you know its slang name is horse tranquilizer? There you go. So it's popular. It's used in veterinary medicine. Then in the 80s and 90s, it became recreationally popular in the UK. But in the 2000s, its use increased because it had a calming, sedative effect. Then in 2020, the pandemic, there was a sharp spike, and increasing up to 2022 to 3, as young people who maybe developed mental health issues because of the pandemic used it to deal with them, to self-medicate. Cheaper than alcohol and no hangover the next day. But very much a double-edged sword, because whilst it's easy to use in theory, dosing isn't difficult, I'm told, it is potent. And you get this initial high, as with so many substances, you feel happy and bouncy. And then you get tolerance, of course, which means you need higher doses to achieve the same effect. Risks, well, there's short-term risks of overdose if you get your dose wrong, especially if you use it with another depressant type drug like alcohol. But this is what users tell me, which I wasn't aware of. They talk about falling down a K-hole, K-hole, ketamine hole, where you become dissociated from your body, looking down on yourself from a great height, even temporarily paralyzed. And at that point, they're at risk from, I don't know, predators who might want to exploit the situation, even from self-harm. However, those are the short-term risks, and it's the long-term risks I really want to bring to people today. And this is where my patient came in, K bladder syndrome. So I think as a doctor, I want to know a bit about it. I guessed it was because ketamine was toxic to what we call the urothelium, the epithelium, the lining of the urinary system, the bladder particularly. And that's absolutely right. The metabolites, when you take in ketamine, you break it down, and the metabolites, the broken down products which go into the urine, are toxic to the lining of the bladder. They cause inflammation, they cause ulcers. And when you get ulcers, the body heals it with scarring. And that's what shrinks your bladder. It can even go up from the bladder to the ureters, on the way to the kidney, and cause renal failure. But essentially, we're talking about ketamine-induced cystitis, uropathy for a flash medical term. So this is a bad drug. And this K bladder, how often is it found? Well, in 70% of users. They start off with frequency of micturition. As you can imagine, if you've got a small bladder, you're going to have to go the whole time. We're talking about shrinkage from your bladder or my bladder, hopefully being 500 mils, to 20 or 30. 20 mils is 2 tablespoons. That's how, literally you're shrinking it to the size of like a large walnut. That's what happens to your bladder. Very severe. Plus, you get mild pelvic pain, bladder pain, back pain. And of course, in the early days, these are mild symptoms and people like their ketamine, so they don't bother coming to the doctor for help at that point. So they continue to use. And at this point, this is when the bladder damage, the chronic bladder damage, takes place. And there's no treatment other than stopping the drug, abstinence. Why do they continue? Well, it's not so much a physical addiction, which you get in some drugs, but a psychological addiction, definitely. And after 2 to 3 months of use, often people are now using it daily at home, so other people are unaware of it, and it takes over your life. How much is it? Well, it's not that pricey, £20 a gram. It's sold as granular white powder, which you snort like cocaine. I'm telling parents not to encourage you how to use it, but just to be aware of what's going on. You snort it. Often youngsters start taking it at music festivals. Since 2016, the stats in the UK is that the number of 16 to 24-year-olds using ketamine has doubled. And the average age for those presenting for treatment is 26. So they start young, and after a few years, they're presenting for treatment. Interestingly, the Alder Hey Children's Hospital, famous hospital in Liverpool, a children's hospital, has opened its first ketamine clinic. This is a children's hospital because it's covering urology problems in the whole of the UK. And in some parts of the country, ketamine is now only after alcohol and cocaine for frequency of use. So we need to do something about it. What do Christian parents need to be aware of? Obviously, need to be aware of the substance itself, the risks and harm. It's a dangerous drug. Don't be fobbed off with the idea that it's not. Interestingly, the government tried to do something about this. They upgraded it some years ago from Class C to Class B. Made no difference. Use increased. So some people were saying, well, maybe we should make it a Class A drug. Well, it didn't work. Make it Class B. What's the point? And therefore, that's not going to happen. What can parents do? Talk to your children about the risks at parties, at festivals. Just because it's easily available, not least as an illicit substance on your mobile phone, that doesn't make it safe. Tell your kids in advance so they don't go down this rabbit hole, because the bladder effects are lifelong. I wouldn't be surprised in the future, just as an aside, if people need bladder transplants for ketamine. Now, one thing that is helping, here's the good news. There's got to be some good news. Well, it's testimony time. We know as Christians, testimonies are hugely valuable. It's young people who've tried ketamine giving their testimony. Here's one. Rose started taking ketamine at university, became a frequent part of her life when she moved in with a friend who was also a user. And that, of course, she started to use it daily, often whilst watching a film together with a friend. Then she began to source her own supply and use it on her own. And she described it as a slippery slope, which began with abdo cramps. And because she was a smart girl, she roughly knew what was happening. So how did she try to escape? Well, by going abroad. But of course, she took her addiction with her. Then she got in trouble with the law for importing an illegal substance, had a short prison sentence when, of course, she had withdrawals, felt completely overwhelmed by her situation. Here's the good news. I'm pleased to say she's back in the UK in recovery and sharing her story on social media to raise awareness of the dangers. So the take-home point was this: parents, be aware this is not a new kid on the block, but it may be a new kid on your block. Talk to your school. What is the school doing about raising awareness? What's the headmaster or headmistress know about it? What are the governors doing? Raise awareness in your own school, because if they're not teaching about it, why not? They need to. Message over.
Yeah, and it's an important one. I guess if you take taking heroin and for a moment, if you take heroin, we would generally think of track marks in the arms or wherever you've got needle marks, and there is an obvious physical sign. Now you can hide that to a degree. Ultimately, you can't, because you'll run out of places to put the needle. Being a little bit careful with how we talk about that, but there are obvious physical signs of someone who is on heroin. Cocaine, I guess, in some ways it might be a little bit less obvious because you might have less physical marks. You don't have to hide those quite the same because you're snorting it. Now you've got a problem with your nose. Clearly, if you're putting stuff at your nose that you shouldn't do, you're going to have a problem.
Vasoconstricts, so you get nasal septal damage. So yes, you can that sometimes is the entry point in terms of spotting it, is the nasal damage. But you're right, it's not as obvious as needle marks.
But then I'm guessing ketamine, if it's a little bit, we're being very cautious with our wording. We did this with smoking and with vapes. It's not safer, but it's perhaps less obviously dangerous initially, which I'm guessing is why people think, yeah, I'll take that. Because if you haven't got to worry about track marks and you are very conscious, well, if I'm using a needle and it's shared, I can get all sorts of nasty diseases. So maybe heroin isn't where you want to go, although addiction, that's a whole other conversation. But with ketamine, if it is that easily available and people don't know of the problems, and that bladder one is terrifying, then I can understand why people might think, hey, let's do that. The question I had for you, though, if you're using a little drop of it to knock somebody out for a piece of surgery, how are people not fully unconscious? Because the whole thing about heroin or marijuana is you're riding a high until you have the massive crash, which is the major problem of it, amongst others. What happens with ketamine? I mean, how come they're not going unconscious?
Well, because the dose is lower. So when we gave it intravenously for an anaesthetic, it's a high dose for a short time, and that if you like overwhelms the conscious level. Unlike taking it orally, the difference here is quite the opposite effect. It's a slow dose over a long period rather than a long dose over a short period, but it is terrifying. I mean, that this patient, he would go to the loo before seeing me. We'd have our 10-minute conversation, and he'd be straight back out to the loo, and that was his life. Now, if you divide your 24 hours into 10, 15-minute segments, well, you'd have to do the maths. I mean, that's 70, 80 times a day, I guess, maybe more even. 6 times 24, whatever that is. That's 150 times a day. I mean, it doesn't bear worth thinking about. It's unbelievable the number of times you'd have to wee in a day. And that was his life until, you there are ways around it. You could have a urostomy. You could drain your kidneys through the skin, a bit like a colostomy. But oh my goodness, all for a substance that you took recreationally and were told was safe. How terrible. So Christian parents, watch out. If your kids are running to the loo a lot and it's not a urinary infection, just be aware.
I mean, it's scary how easily stuff can be available for folk. That always makes me nervous. We know that so many people go into prison and start drug taking, which is such I don't even know how I feel about that. I haven't got the words for it, of how disgusted I am that we're not protecting people for whom we have taken their liberty away. We are now caring for them. And while we're caring for them, here are some drugs, which of course, are they allowed to have it for prison population to be more peaceful? That's a bit of a suggestion that's out there. I'm not saying that's true or not. Is it because there's not enough care, not enough prison guards? I don't know. But if people are taking drugs in the one place we're trying to protect them, and let's be honest, if they're in a prison, they are now under the care of the state. We're failing, and it feels like we are failing in regards to ketamine, because I don't know. Sometimes I think, where's the outcry? Where's the outrage? Where's the shouting? People are on the streets protesting for stupidity and not against stuff like this, which is far more important. Because you said this is basically when your bladder starts to shrink, it's not, oh, I'll stop taking it, now it grows again. This is 50, 60, 80 years of no bladder.
Scarring is scarring. If you have a scar, it's there. And you can't cut a scar out. You form another scar. So the only treatment for that ultimately would be a bladder transplant.
Would people get, I don't know how transplants works. Maybe that's an interesting conversation another time. But my very, very poor understanding as a person who has no knowledge of medical apart from you, isn't there an issue if you've caused some damage to yourself? Aren't you less likely to get transplanted organs? Or is that false?
Well, not so much, because if you look at, I don't know, liver transplants, take the George Bests of this world. If you stop drinking and you have a liver transplant, the new liver should be fine. But the issue is, will you continue to take the substance?
Okay.
And obviously he did, and died young as a result.
Yeah.
No, if you the only cause of the shrinkage and the damage is the ketamine, and you stop taking ketamine and you've got a fresh new bladder, all should be well. But I can tell you, taking a bladder out is a right business surgically, and putting a bladder in, I've never seen. It'll happen one day, I'm quite sure, and it may need to happen for these young addicts.
Wow, which is so sad. The thing is, we talk about things like smoking. We looked at recently. We looked at smoking, a cigarette versus a vape, and our basic conclusion was, well, vapes are not safer. They're just not quite as terrifyingly dangerous as a cigarette. Would be my version of it. And we're talking about ketamine, which seems ostensibly to be less critically bad than heroin or cocaine, but it's not. It's not a good product. That was the other question I had. So you're using it on a patient to knock them out to do surgery. Does their bladder not shrink? Do they not have the same problems when you're doing it in a hospital?
It's an acute use of a drug, not a chronic use. That's the difference. The other thing, which of course is quite interesting, and it came to my mind when you look at ketamine, people take it for a calming, sedative effect, a mild tranquilizer, if you like, exactly the same, say, as cannabis. And of course, what's happened now is there's such strong types of cannabis around that it's causing psychosis. So you think a drug is safe, but actually it's not. Now, ketamine, interestingly, probably in lower doses causes trouble compared to, say, cannabis. But cannabis is thought, again, to be safe by so many people. Oh, we ought to take it off the list of dangerous drugs. It should be freely available. Not in the versions that are out there. It's really dangerous. And I've seen absolutely psychotic people due to cannabis. And again, the effects aren't always reversible.
I knew a guy that took cannabis, was very clear. I've never bought it, he said. This is years ago now, 15 years ago. I'll grow my own, then I'm safe. Now, that's still highly criminal in the UK. But when I met him, 10 years having stopped taking it, this is 10 years after, this is 15 years ago. He'd not taken it for about 10 years. He was, I don't know, he just looked mentally ill. He was a truck driver. And he scared me because he was not right in the head at all. I can't put it another more polite way. He was not right in the head when I spoke to him. He was the most paranoid person I'd ever met. I asked him a question and he was down my throat. Why are you asking me that? I think it was, where do you want the pack of blocks or something? It wasn't, invasive. But what I saw, the one person who I'd known had been on cannabis for a number of years, admitted it was wrong. I shouldn't have done that, but I grew my own so it was safe. Well, no, because what I'm seeing isn't, and you are not right in the head. And there was a permanent, effectively, brain damage.
Yeah, it's very sad. So I'm just hoping that none of our listeners enter this situation. But if it's as common as it seems to be, we just need to go and look after our teenagers and our grandchildren, teenagers, when mine grow up, with your eyes open to what's out there. It's not that they're bad kids, but they're getting offered bad substances.
But again, as we spoke about when we talked about cigarettes, we were talking about, because in America there was a study by Johns Hopkins that's saying that basically children are moving into smoking through the route of vaping, which is what you're supposed to do instead of smoking. So clearly it is, to use the phrase, a gateway drug. Ketamine, music festivals, you have rave going back along with ecstasy, was of course the big problem back then. And it just, there's always something, but I think we would do a disservice if we did not bring faith into this.
Indeed.
Because the question isn't, what are they taking? How can we spot it? What can we do about it? Yes, that's good questions. The more important question is not what do we do about it, but how do we prevent it? And the way you prevent it is you withdraw the need for something. So my question then is not, why are they taking ketamine? Well, because it feels good. It's not good for you, but it's going to feel good for a bit. Cocaine, heroin, it's exactly the same. It's terrible, but nobody would do it if there wasn't some plus, even though the plus is completely drowned out by the negative. There has to be a reason for it. But my question is, what are we doing for the children and teenagers in the UK, which is what we're talking about? How do we support them so they don't have a massive hole in their life that they fill with a drug to try and take them out of their life? That is not something we're going to solve today in 10 hours. But I think we've got to touch on that a little bit, because you've clearly seen lots of drug addicts. I'm going to have a wild guess, because I know a little bit about this, and they probably didn't have great lives, which is probably why they're on drugs.
Absolutely. And I have to say that when Heather and I worked so hard to get drug addicts off drugs, it was always about not just saying drugs are bad, but that faith is good. You offer them something better.
Yeah.
And you're quite right. If we bring up our kids, loving the Lord, worshiping the Lord, they don't need an artificial high from ketamine. And also, but education as well. If you get offered something at a party or at a festival, don't take it. Simply don't take it, regardless of what it is. Do not take it. Number one, you don't need it, but don't take it anyway. But hopefully, as you say, if we can bring up the kids to love the Lord, then yeah, the dangers are at least mitigated.
I think the other thing that I remember growing up is, if you go into a party when I was growing up, the 90s, whatever, if someone offers you a drink, you say no. You buy a bottle of drink. If you're in a pub, if you buy a bottle of beer and you open it, the contents of that, because you're buying it from a barman, it's going to be okay to drink. So it was one of the simple things, especially to women, because in the 90s, there weren't really that much going on in terms of drug taking into alcohol, which there is today. We've got the date rape drug and all that. That wasn't really a problem in the 90s. It didn't not exist, but it wasn't a major problem. So the girls were simply told, buy bottled beer. Then you will know that your drink has not been spiked with, at that point, probably a very, very high concentration of alcohol, which would do the same effect slightly slower.
Indeed, absolutely. So yeah, just wanted to bring something to the listeners today, just to be aware of. It's a bit depressing, but it's life. And as Christians, let's do better. Let's avoid it in the first place, and also but be aware at the same time of what's going on out there.
But I think that the thing you've said, and smoking or alcohol, it doesn't matter what the topic is. I think that the point is, it's not saying to people don't do this. Yeah, please don't do this. This is really bad for you. But if we say don't do this, it's not very helpful. What we should be saying is do this. The positive is always better than trying to negate by neutralizing a negative, because it's very complicated mentally. But if you say, here's something good, then you will. If you say to people, don't eat bad food, but they know how to cook, well, you've just had a pointless conversation. Junk food's bad. Well, yes, but food is better than death from hunger. So don't say junk food is bad. Say, here's how you can do something interesting with your food, because then you can make something nice. And the positive is always better and far easier than undoing a negative, which probably will be part of it. But rather than going down that road of complicated, let's get rid of what isn't good, let's inject something inject is the wrong word, isn't it? Let's bring in something that's good.
Yes. Well, no, you've nailed that one. Thanks for bringing it up.
Well, I think we had to touch on it a little bit, because it is a hard topic. It is pretty depressing, but also we need to talk about these things. It's important, and people need to know how easy this stuff to get. If people are getting hooked like this, and it's becoming to the point that hospitals are now saying, right, we're gonna do for children, we're gonna help them with a horse tranquilizer because now they're getting addicted and the bladders are disappearing. That is a national crisis, which is far more important than the usual nonsense we see on the streets being shouted about. This actually needs to be dealt with. But if we can shine a light for someone who's thinking, why is my child going to the thing? The doctor said they've not got a bladder infection.
Good. I mean, the Bible, God always says, don't do this and do this.
Yeah,
this is the way forward, and this is the way backwards, if you like. And he makes it very clear. This, the Bible is very clear. So you're all we're doing really is replicating the way that God works, which is stop. This is bad. Leave it alone. By the way, this is good, and it'll just change your life in a positive way.
Like the classic, do not be anxious. God didn't stop there. Do not be anxious, but when you're anxious, do this.
Yeah, absolutely.
Listen up to what we're talking about. This is important stuff. It doesn't matter whether it's ketamine, heroin, cocaine, alcohol, working. We can get addicted to all sorts of things. And if we're not careful, it starts to destroy our life. But rather than taking out the bad, put in the good, and it'll force the bad out all on its own. Little Andy B, wisdom for you, such as it is. Richard, thank you.
Thank you.
If you've got any questions for Richard, you can send them through to us. hello@pure247radio.org. hello@pure247radio.org. You can put your questions to Richard. Or if you've seen a medical list and you're thinking, what on earth is that all about? We will do our best. Well, he will. I'll just say hello to him. To try and answer your questions and shed some helpful light on the life around us. Richard Scott, the good doctor. Thank you, sir.
My pleasure.